All right, let's dive in. Today, we're tackling sports hernias.
Ooh, interesting.
We've got a stack of articles to unpack, and whether you're an athlete yourself or just curious about this injury that seems to be everywhere these days, we're going to get to the bottom of it.
Sounds good.
The big question, though, is it really a hernia? We're about to find out.
Yeah, I think there's a lot of confusion around that term.
Right. There's some serious medical info to break down, but we'll make it clear, relevant, and maybe even a little bit fun along the way.
All right, I'm ready.
Perfect. I've been going through all this research, and honestly, some of it had me scratching my head.
Yeah, I can imagine.
So tell me, what's the most surprising thing that jumped out at you?
You know, the term sports hernia is kind of like a trick play in medicine.
Oh, how so?
Well, it sounds straightforward, but it causes a lot of confusion.
Right, I can see that.
The biggest misconception is right there in the name, because more often than not, there's no actual hernia involved.
Wait, hold on. So if it's not a hernia, what's causing all this pain that's benching these athletes, and why does it seem like everyone's getting them these days?
It's true, it's not uncommon, and the pain is definitely real.
So what is it then?
What we're actually dealing with is chronic strain and microscopic tears in the muscles and tendons in the groin and lower abdomen.
Okay, so tiny tears in the muscles, not an actual hernia.
Right. Think of it this way. Imagine those muscles and tendons are like ropes,
Okay, I'm with you.
constantly twisting, turning, sprinting, kicking, all those explosive movements you see in sports. It's basically like fraying those ropes over time.
So those repetitive movements are slowly wearing down those muscles and tendons.
Exactly.
Okay, that makes sense. But I'm thinking about those intense pro-level athletes.
Right. The ones constantly pushing their limits.
Yeah, are they the only ones at risk here? Is this something the average weekend warrior needs to be worried about?
That's a great question. It's true that men and athletes in high-impact sports like hockey, soccer, and tennis are more susceptible.
Because of the constant strain on those muscles, right?
Exactly. But it's not exclusive to them.
So you're saying even casual athletes can experience this?
Absolutely. Even someone playing a casual game of basketball or doing some weekend gardening can experience this.
Really? Just from everyday activities?
Well, think about it. That athletic stance. Think about the bent forward posture in tennis or the ready position in baseball that can put those groin muscles under constant strain, even if you're not a pro.
So even if you're not playing at a professional level, those everyday movements can still put you at risk.
That's right.
So this sports hernia is more common than we might think.
It definitely is.
But if it's not a visible hernia, how in the world do doctors even diagnose it?
Yeah, that's a good question.
I mean, there's no telltale bulge or anything, right?
You're right. Diagnosis can be tricky.
I bet.
It's like a medical detective story.
So how do they do it?
Doctors have to rely on the athlete's description of the pain where it is when it's worse.
So they have to really listen to their patients and what they're experiencing.
Exactly. And then they try to recreate those movements during a physical exam to see if they can trigger the pain.
So it's about pinpointing those specific movements that cause those deep internal twinges.
Precisely. And even then, it's not a slam dunk. They have to rule out other conditions that might be causing similar pain.
Oh, right. There could be other things going on.
Imaging techniques like MRI and dynamic ultrasound can be helpful for visualizing the affected muscles and tendons, but it's not always a clear-cut diagnosis.
It sounds complicated.
It can be.
One of these articles mentioned a study on hockey players, and I have to say the risk factor they highlighted was pretty surprising.
Oh, which one was that?
Not conditioning enough in the off-season.
Ah, yes. That's an interesting one.
That seems counterintuitive. You'd think being in season would be riskier.
You would think so, wouldn't you?
So what's the explanation there?
It highlights the importance of consistent training and conditioning year-round, not just during the season.
So even when they're not playing, they need to stay in shape.
Exactly. Imagine those muscles are like elastic bands.
Okay.
If they're not regularly stretched and strengthened, they become less resilient and more prone to tearing.
So anyone listening who might have slacked off a bit during the off-season, it might be time to hit the gym and start building up that resilience.
Absolutely. It's like building a strong foundation to support those powerful movements.
A good analogy. But even with the best preventative measures, sports hernias can still happen.
That's true.
So let's talk about what happens when an athlete is diagnosed. What are their options?
Okay, so we're shifting gears now from prevention to treatment.
Exactly. Let's say you've got this nagging groin pain that just won't quit. What's the fix? Is it rest and ice packs, or are we talking about something more serious?
Well, there's a range of approaches.
Okay, let's hear them.
Conservative treatment, like rest, ice, and over-the-counter pain relievers, is usually the first line of defense.
Makes sense. Start with the basics.
However, for those high-level athletes who need to get back in the game quickly,
Think pro athletes on a tight schedule.
exactly, those conservative options are often just not enough.
To get them back to peak performance.
Right. In fact, studies show that athletes who choose surgery for their sports hernia return to play an average of 4 weeks sooner than those who rely on rest and rehab alone.
Wow, 4 weeks. That's a significant difference, especially when you're talking about a professional athlete's career.
It is.
So in those cases, surgery becomes the go-to solution.
It often does, especially for long-term relief and getting back to that competitive edge.
It can see why.
Now, I know the word surgery can sound intimidating, so let's unpack what that actually involves.
Yeah, let's break it down a bit.
There are two main approaches: laparoscopic and open surgery.
Okay, laparoscopic versus open.
Right, let's talk about the pros and cons of each.
Well, all years.
Laparoscopic surgery is the less invasive option.
Less invasive, so smaller incisions.
Exactly. Surgeons use small incisions and a tiny camera to guide the repair.
Kind of like a high-tech, minimally invasive procedure.
That's a great way to put it. And it typically means a quicker recovery time and less scarring.
Sounds appealing. But I'm guessing there are situations where open surgery is the better option.
You're right, it's not always a one-size-fits-all situation.
So when would they choose open surgery?
Open surgery involves a larger incision, but that gives the surgeon a more direct view of the affected area.
More visibility for the surgeon.
Think of it like this. If the damage is extensive or if the repair is complex, sometimes you need that wider field of vision to get the job done right.
So there's a trade-off, less invasive versus a potentially more thorough repair.
Right, it's about finding the right approach for each individual case.
What factors go into making that decision?
It's a collaborative decision between the athlete, the surgeon, and often a physical therapist.
So a team effort.
They'll consider the severity of the injury, the athlete's sport and activity level, and their overall health.
Makes sense, a lot to consider.
And there's actually some fascinating research that compares the long-term outcomes of surgery versus rehab alone for chronic groin pain diagnosed as a sports hernia.
Oh, interesting. So they looked at what happens when you choose surgery versus just trying to rehab the injury.
Exactly. This study followed a group of patients who were divided into two groups.
Okay, half got surgery, half didn't.
Right. Half underwent laparoscopic surgery, while the other half received physical therapy and other non-surgical interventions.
So they were comparing apples to apples, basically.
As much as possible, yes.
And what did they find?
The results after 3 months were pretty striking.
Right, I'm on the edge of my seat. What were the outcomes?
Almost every single patient who had the surgery was back to their full level of athletic activity within 3 months.
Wow, that's impressive. So surgery seems to have a clear advantage when it comes to getting athletes back in action quickly.
It does seem that way.
But what about the group that didn't have surgery? What happened to them?
Well, only a small fraction of those who relied solely on rehab had the same level of recovery at the 3-month mark.
Oh, so a much lower success rate.
Many of them were still experiencing pain and limitations, and a significant number ended up opting for surgery later on because their pain persisted.
So it seems like in many cases, surgery might be the most effective route to long-term relief.
That's what the data suggests.
But before we get too deep into treatment, I want to rewind for a second. This study also tracked complications, right? We have to address the risks.
You are absolutely correct.
What did they find there?
It's crucial to understand the potential risks and complications associated with any surgical procedure.
Of course, there are always risks.
In this particular study, they found that serious complications, such as infections or nerve damage, were extremely rare.
That's reassuring. It sounds like the benefits often outweigh the risks, especially for athletes eager to return to their sport.
It seems that way, but of course,
But I know every case is unique, and it's always important to talk to your doctor to weigh the pros and cons.
I couldn't agree more.
Individualized care is paramount.
Absolutely.
Okay, so let's fast forward a bit. Someone's had the surgery, they've gone through rehab, they're ready to get back to their active life.
Back of the game.
What are their chances of truly kicking that nagging pain for good? What does life after a sports hernia look like?
Well, the good news is that with proper surgical repair and a dedicated rehabilitation program, the outlook is very optimistic.
So there's hope for a full recovery.
Studies show that up to 90% of individuals experience significant long-term improvement in pain and function after surgery.
That's fantastic. It sounds like a real game changer for those who've been struggling with this injury.
It can be.
But is it a guaranteed fix? Is there a chance of recurrence?
While the success rates are high, recurrence is possible, especially if someone doesn't take those preventative measures we talked about earlier to heart.
So even after surgery, you can't just go back to your old habits.
It's not just about fixing the immediate problem. It's about addressing the underlying factors that contributed to the injury in the first place.
So it's not a one-and-done solution.
Not really.
What kind of steps can people take to prevent those recurrences and really stay in the game for the long haul?
Well, this is where things get really interesting because prevention goes way beyond just warming up before a game.
Right, we need to address those underlying causes.
It's about understanding those repetitive movements, the twisting and turning that we talked about,
Yeah.
and how they can put so much stress on your groin and lower abdomen.
Yeah, like those tiny frays in a rope.
Exactly. So wouldn't it be great if we could strengthen those muscles in a way that specifically addresses those vulnerabilities?
You mean like target those weak spots?
That's the idea behind targeted training.
Okay, I like where you're going with this. So we're talking about exercises that focus on strengthening the muscles most likely to get strained during those athletic movements.
Precisely. We're talking core strength, hip stability, and flexibility in those inner thighs and hip flexors, basically, building a fortress around those vulnerable areas.
So like reinforcing the foundation.
Exactly.
Okay, I'm starting to see the connection here. But I have to admit, I'm no doctor or physical therapist.
Right.
I wouldn't even know where to begin with designing a sports hernia prevention workout.
That's where working with a qualified professional comes in.
Okay, so get some expert guidance.
A good physical therapist or athletic trainer can assess your individual needs, taking into account your sport, your activity level, and any pre-existing weaknesses.
So a personalized approach.
They can create a customized program that targets those specific areas.
So it's about getting that personalized guidance, not just relying on generic advice from the internet.
Exactly. What works for one athlete might not be the best approach for another.
Because everyone's body is different.
Right. They can teach you the proper form for each exercise, make sure you're engaging the right muscles, and help you gradually increase the intensity without overloading those vulnerable areas.
So it's like building a house. You need a solid foundation before you start adding the walls and the roof.
That's a great analogy.
I love that analogy, building a strong foundation to prevent those micro tears from happening in the first place. But we can't forget about flexibility, right? I remember you mentioned tight hip flexors earlier.
You got a great memory.
Yeah.
Flexibility is just as crucial as strength when it comes to preventing sports hernias.
It's all connected.
Those tight hip flexors can actually pull on your pelvis, which throws off your alignment and contributes to that strain in your groin.
So stretching is just as important as those strengthening exercises.
Absolutely. Imagine your muscles as elastic bands.
Okay.
If they're too tight, they're more likely to snap under pressure.
Makes sense.
But if they're flexible and supple, they can handle those sudden movements and changes in direction without tearing.
Okay, this is all making perfect sense. But I have a question. We've been talking a lot about the physical aspects of prevention.
Right, the exercises, the stretching.
But is there a mental component to this as well?
You hit the nail on the head. You know, sometimes athletes get so focused on pushing their limits, on that no pain, no gain mentality,
Yeah, I know that mentality.
that they ignore their body's signals.
Oh, yeah, I've definitely been guilty of that.
And that can be a recipe for disaster.
Yeah, ignoring those little twinges thinking you can just push through it. Not always the smartest approach.
You're right. When it comes to preventing injuries, learning to listen to your body and recognize those early warning signs is absolutely essential.
It's about being in tune with what your body is telling you, not just powering through the pain.
Exactly.
So what are some of those warning signs that we should be paying attention to? What should set off those alarm bells?
It could be a slight twinge in your groin during a workout, stiffness that lingers after activity, or even pain that comes and goes.
So those little aches and pain.
Those subtle cues are often your body's way of saying, hey, something's not quite right here. Pay attention.
So we need to learn to differentiate between the good type of sore muscles after a workout and the kind of pain that signals a potential problem.
Exactly. And this is where that mental awareness comes in.
Tuning into your body.
It's about being in tune with your body and knowing when to back off, modify your workout, or even take a rest day.
It's not about being weak or giving up. It's about being smart and preventing a minor issue from becoming a major setback.
Exactly.
I love that reframing. It's not about weakness. It's about being proactive and taking care of your body. And it seems like proper warm-up plays a big role in this as well, right? We talked about it earlier, but it's worth emphasizing again.
You're absolutely right. It's such a fundamental part of injury prevention, yet it's often rushed or overlooked.
I know, I've been guilty of that myself.
A good warm-up prepares your muscles for the demands of your workout, increasing blood flow, flexibility, and range of
It
motion.
gets you ready to go.
It's like getting your car engine warmed up before hitting the highway.
And that can make all the difference in preventing those strains and tears.
Absolutely.
So a good warm-up, targeted strengthening and flexibility exercises, and that crucial mental awareness of our body's signals, it sounds like we've got a solid prevention plan coming together.
We're getting there. But there's one more piece to the puzzle that's often neglected, and it plays a huge role in both performance and injury prevention.
Oh, I'm intrigued. What is it?
It's recovery.
So we're talking rest days, proper sleep, nutrition, all that good stuff.
You got it. Our bodies need time to repair and rebuild after we push them.
I know that logically, but it's hard to actually put it into practice sometimes.
I understand adequate sleep, the right nutrition, and those all-important rest days are essential for muscle recovery and injury prevention.
It's not all about pushing yourself to the limit all the time.
It's during those recovery periods that your body gets stronger, not during the workout itself.
That makes so much sense. You can't keep pushing your body to the limit without giving it a chance to recharge.
Exactly. Think of it like this training breaks down muscle tissue, and recovery allows it to rebuild stronger. It's a cycle. You push, you recover, you come back stronger.
So rest and recovery aren't signs of weakness. They're essential parts of the process.
That's right.
It reminds me of those hockey players we talked about earlier,
Yeah.
the ones who didn't condition enough in the off-season.
Right.
Their bodies hadn't fully recovered and rebuilt, making them more vulnerable to injuries.
Exactly. That off-season period is crucial for recovery and laying the groundwork for the next season.
So it's a cycle train, hard, recover fully, repeat.
Right.
And each phase is equally important.
Precisely. By prioritizing all aspects of this cycle, training, recovery, and that mental awareness, athletes can significantly reduce their risk of sports hernias and other injuries.
I'm really starting to appreciate the holistic approach here. We've gone from talking about targeted exercises to the importance of sleep and nutrition.
Right. It all plays a role.
It's about taking care of your body from the inside out.
And there's one more often overlooked aspect that ties into this whole body approach,
Yeah.
and it might surprise you.
Oh, you've got me on the edge of my seat. Tell me more.
Well, it all comes down to your feet. Or, more specifically, the role that the right footwear and support can play in preventing groin strain.
Wow. I never would have connected those two things. How does what's on my feet impact something like a sports hernia?
Well, think about it this way. Your feet are your foundation.
Okay, yeah, that makes sense.
They absorb impact with every step, every jump, every change of direction. They provide stability and influence the alignment of your entire body.
So are you saying if my feet aren't properly supported, it could actually create a chain reaction all the way up to my hips and groin?
Exactly. Ill-fitting shoes, worn-out insoles, or even just wearing the wrong type of shoe for your activity can throw off your gait, how you walk and run.
And that affects everything else.
And that can put extra stress on those vulnerable muscles in your groin and abdomen.
Okay, so what should we be looking for in terms of supportive footwear? I know there are a ton of options out there.
It definitely depends on the activity. A runner needs different support than a basketball player, for example.
Right, different sports, different needs.
But generally, you want shoes that provide good arch support, cushioning to absorb impact, and stability to keep your feet from rolling inward or outward excessively.
So maybe not those super trendy sneakers that prioritize style over function?
Yeah, fashion over function is rarely a good recipe for injury prevention.
Good point.
And it's not just about the shoes themselves.
What else?
Sometimes custom orthotics or even those over-the-counter insoles can make a world of difference in aligning your feet and reducing strain on the rest of your body.
I'm really seeing how interconnected everything is. We've gone from core strength and flexibility all the way to the importance of what we put on our feet. It really is a whole body approach to preventing sports hernias.
It really is. And it underscores why working with knowledgeable professionals like physical therapists and athletic trainers is so valuable.
To get that expert advice.
They can look at your individual movement patterns, assess your foot mechanics, and recommend the type of footwear or support that's going to best suit your needs.
So it's like having a personalized pit crew for your body, making sure everything is aligned and running smoothly.
I love that analogy because at the end of the day, that's what it's all about. understanding our bodies, listening to their signals, and taking proactive steps to prevent injuries before they take us out of the game.
We've covered a lot of ground today, from myth-busting what a sports hernia really is, to exploring those cutting-edge treatments, and then really diving deep into prevention strategies. We've learned that it's a multifaceted approach: strength training, flexibility, recovery, even footwear, and that every aspect plays a crucial role.
And it all comes back to that idea of empowerment,
Yeah.
understanding our bodies and making informed choices that support our overall health and athletic goals.
Absolutely. We've delved into the science, shared those real-world examples, and hopefully given our listeners the knowledge they need to stay healthy, active, and injury-free.
And maybe even sparked a newfound appreciation for just how incredible and interconnected our bodies really are.
I love that because ultimately that's the goal: to understand our bodies, listen to their signals, and take those preventative steps so we can keep doing the things we love for years to come. Thanks for joining us on this deep dive. We'll see you next time for another fascinating exploration.